Many people know about breast cancer, colon cancer, and prostate cancer screening. However, you may not know about lung cancer screening. We have a powerful tool to screen for lung cancer, and that's called low-dose CT screening. If we can find lung cancer early, there is a huge improvement in survival. If we find out lung cancer in stage 1A, your chances of survival over 5 years is over 90%. The survival rate continues to decline if we find lung cancer with a higher stage. If the stage is 4, then your 5-year survival drops down to less than 10%. I want to convey this message clearly that early detection of lung cancer saves life. Lung cancer does not show symptoms in the early stages. We don't get symptoms until lung cancer goes into advanced stage. However, if you start to have cough that does not get better, you start to have coughing up blood, shortness of breath, chest pain, or if you start to lose your appetite or lose your weight, I encourage you to speak with your healthcare provider. Low-dose CT scan is quick and painless. We scan your lungs. It's a painless procedure. We utilize small amount of radiation and it can detect tiny spots in your lungs, and that's called lung nodules. Those lung nodules could potentially be malignant, so we like to detect them early. What's exciting about low-dose CT screening is that we can find out those tiny spots before you start to have symptoms. And if we find out those nodules early, if they are potentially malignant, we have so many treatment options to potentially cure this condition. So you may wonder, who should be screened for lung cancer? You meet the criteria for this life-saving annual screening if you are between the ages of 50 and 80 and you have a history of smoking equivalent to a pack a day for 20 years. For someone who smokes 1 pack a day for 20 years would have the same pack year history as someone who smoked 2 packs a day for 10 years. Whether you are a current or former smoker, if you meet the screening criteria, talk to your primary care provider. Just because you feel fine does not mean you should wait. Get the screening done, and the best time to do is before you get any symptoms. If something is found, you are not alone. Riverside has a lung nodule clinic dedicated for these nodules and will get you in faster. When you come to the lung nodule clinic, you will meet with one of our pulmonary physicians. They will go over your symptoms, they will go over your scan, and will find out what is the risk there. The vast majority of these nodules are not cancerous. If those nodules are concerning to be potentially malignant, we recommend biopsy, and we can do biopsies several ways. And those ways depends on the location of your nodule, size of your nodule, and your preference also. Our pulmonary doctor perform bronchoscopy. We have an endobronchial ultrasound that's called an EBUS bronchoscope that can get the biopsy if there are lymph node closer to your airway. If you have a nodule that's very close to the chest wall, we can send you to a radiology doctor who can do biopsy under CT scan guidance. And some other occasion, we send you to our thoracic surgeon who can perform biopsy in the operating room. However, if you have a nodules that's located periphery in the lungs, we utilize most advanced way of biopsy that's called robotic bronchoscopy. This advanced technology is transforming how we diagnose lung cancer. Robotic navigational bronchoscopy allows us to access all 18 segment areas of the lungs with incredible precision, reach small nodules even in difficult to access areas, perform biopsy with minimal invasion, detect cancer with increased sensitivity, and diagnose cancers earlier so treatment can begin sooner. Now we can access all segments of the lung, and Riverside has invested and got this new robotic bronchoscopy for our community, so we can utilize that tool to biopsy your lung nodule. We are finding the results of this robotic bronchoscopy to be extraordinary for our patients. Of our first 100 cases, we found 48% of them with lung cancer. Out of 48, 62% were diagnosed in the early stage. We are excited for those patients because all of them are potentially curable. Riverside has all of those technologies available and will use the most appropriate technology in your case. If lung cancer is found, Riverside Cancer Care Network is here to walk you through every single step going forward. We have all experts to help in your cancer care. That includes dedicated lung cancer navigator, pulmonologist, medical oncologist, radiation oncologist, and thoracic surgeons. Riverside Cancer Care Network offers the most advanced care and treatment options for our patients. Right here in our community, we have robotic surgery, radiosurgery, radiation therapy, and systemic therapies such as chemotherapy and targeted newer immunotherapies, all personalized to your cancer. We host tumor board to discuss your unique need. So we discuss about your personalized medicine, and depending upon your lung cancer type, location, nature, and several other factors, we offer you the best possible treatment available. When it comes to lung cancer, timing of detection means everything, so get screened. Your health matters, so please don't wait until you start to have symptoms. Early detection is not just a statistic. It prolongs your life, and you can enjoy your life with your loved ones.